So this is, as you mentioned, phase 3. So they're the two duplicate studies, sister studies, looking at Zasocitinib, which is a highly selective TYK2 inhibitor, with both placebo and active comparator controlled. So the active comparator in this case being apremilast. And so we have Zasocitinib to apremilast and placebo in a 3:1:1 ratio for the first 16 weeks. And then there's another time point at week 24. So first of all, they had met all key primary and key secondary endpoints were all statistically significant. So that's always great and comforting to know when you're looking at the data from a study. What stood out most to me is that at week 16, about half of patients were able to achieve clear or almost clear skin with a daily dose of Zasocitinib. So that's achieving a PASI 90. And 3 out of 10 patients at week 16 were completely clear, which is our ultimate target for our psoriasis patients. What was also interesting was statistical significance achieved with Zasocitinib compared to placebo as early as week 4 for a PASI 75 achievement. So we get rapid onset with a good proportion of patients clear, and the improvement continued throughout the study. I think what's exciting is that we're seeing the levels of biologic efficacy. So in the past, has been a bit of a trade-off with our oral therapies being a little less effective than the biologics, whereas when you have a highly selective inhibitor of TYK2, which is really blocking interleukin-23, the key regulatory cytokine in psoriasis, you're able to get those high levels of clearance early on with an once-a-day oral therapy. Yeah, I mean, we've seen it with other TYK2 inhibitors where we have improvement over the current or conventional systemic agents such as methotrexate, but also PDE4 inhibitor apremilast. So we're getting higher levels of improvement with better tolerability. I think the selectivity really sort of is more about the safety and tolerability of an agent because you're able to increase the amount of medication dose when it's selected for TYK2 because then you're not blocking the other JAK inhibitors. Whereas you have a broader inhibition, you have to limit the dose based on adverse effects. So when we're just blocking TYK2, you don't have that same limitation in dose. So you're able to increase the dose to get that extra efficacy without having a safety trade-off. Yeah, so over the past decade or two, we've really focused on improving the clearance rates or the efficacy rates with psoriasis medications with the target of being clear skin or almost clear skin. But now we actually have the tools to be able to get our patients clear, almost clear, because we know that there is a quality of life benefit in patients, even if they're clear compared to almost clear and almost clear compared to, say, like a mild global assessment. So having a once-a-day oral therapy, which is very easy for a patient to take, so we're not impacting their quality of life with the treatment option, but we're also freeing them from their disease that they've been suffering with for many years, some decades, where they have to think about their psoriasis on a regular basis. So giving them clear skin takes away both the physical burden and the psychological burden of psoriasis. Yeah, I mean, it's nice to know if it works in all populations. That's always a key. If it has the longevity to maintain the effect is always an important one. What happens if you stop a medication? That's also we have studies that are designed with a randomized withdrawal, including this one. So all of these answers will come out with time and different sub-analyses. So it's a great future ahead. There's going to be some more data coming out and hopefully a new option for our patients.